I'm Sarah Atkinson, and I'm a Senior Associate in the Clinical Negligence and Personal Injury team at Thompson, Snell and Passmore.
I'm Flora Midgley and I'm an associate in the team. And today we're going to talk about people who've suffered brain injuries and how we can help.
Suffering a brain injury can be a traumatic and life-changing experience, and the impact can flow beyond the individual person to their family and their friends. Quite often, when a person's had a brain injury, they don't show any visible signs of an injury, depending on their area of the brain that's been affected and the severity of the injury.
So sometimes people come to us because they want to find out if someone is at fault. So we can investigate whether they might have a personal injury or a clinical negligence claim. For example, they might have suffered an injury while at work, or they might have been involved in a road traffic accident. A family might come to us if they're worried that their child has suffered a brain injury at birth, or someone might be concerned that there's been a delay in diagnosis of treatment in terms of stroke or a brain tumour or an aneurysm. And we can help guide people through the legal process to try and help them in practical ways, but also to try and obtain compensation for them.
People are quite often concerned about the financial impact of a brain injury on them. Maybe they're not able to work anymore, so they can't earn a living for their family. Maybe they've got needs that they've got to pay for, such as care and equipment, and that can be quite frightening. So we can start to point people in the right direction so that they can access services and they can access benefits. And we can also look into whether they might have a claim for compensation that might help to ease that financial burden. One thing that people are often concerned about when they consult a lawyer is whether they're going to be able to afford the lawyer's fees. But most times we can find an easy way of funding a claim that won't need any upfront payments. Often that's through a policy of legal expenses insurance, or more frequently, a conditional fee agreement.
Sometimes when people come to us, it will often be quite soon after they've suffered a brain injury and they might be looking for practical help. And because we've been doing this work as a department for quite some time, we know who to turn to in terms of trying to find people the best help in terms of rehabilitation, care in the community, and sort of signposting people to perhaps different charities or services. So we not only do we try and obtain compensation for them, but we also try to help them in terms of getting rehabilitation at an early stage, because we recognise the importance of getting rehabilitation as soon as possible to try and help people.
Sometimes people come to us after they've received their award of compensation, and maybe they want to set up a personal injury trust, or sometimes they need to appoint a deputy to manage the funds for them. We have a separate team that deals with those types of issues and can help people to set everything up and then to manage the money.
Although we obviously can't change what's happened, we feel privileged to work in this area trying to help people both through the legal process and in terms of getting the rehabilitation and support they need and helping them to obtain compensation. We recognise that if we can obtain them a payment of compensation, it's going to make a really life-changing difference to them. And we are a friendly and approachable team, and we like to update our clients regularly and really get to know each and every one of our clients as an individual so that we can help them to meet their own goals.
If you'd like to get in touch with us or our team, please visit our website, where you'll also find lots of useful information, including a brain injury guide.